It's a pleasure.
For more on this, I want to bring in Congressman Matt Cartwright. Congressman, good to see you on this Mother's Day.
Happy Mother's Day to everybody, and nice to be talking to you from downtown Pittston, Pennsylvania.
Let's start with Obamacare, where we just left off, since this again another vote to repeal Obamacare coming up this week. It will be somewhere between the 35th and 45th vote. This is what House Minority Leader Nancy Pelosi said about it on Thursday.
This is what, the 40th time they will do it, isn't it? Is it 38, 39, 40, 41? Somebody told me 40. I don't know what the clamor is. It seems like a week doesn't go by that some version of it isn't there.
Again, we're all having a sort of difficult time keeping track of the exact number. This one is going to be your first time voting on the bill. Are you excited about that, or is this a waste of time?
It's not only a waste of time, it's a big waste of money. Everybody knows that Obamacare is the law, that Obamacare is not going to be repealed. The Senate is not going to affirm anything that the House does along those lines. So we are not only wasting time, we're wasting money. And there are a lot of other important things we could be doing, like focusing on the economy and bringing jobs back to the United States.
Have you guys already started to see the effects of Obamacare take place in your district?
Well, we have, and what we're grappling with here in Pennsylvania is the Medicaid expansion. As you know, it varies from state to state whether the governors are going to accept the Medicaid expansion. And here in Pennsylvania, we have Governor Tom Corbett, who has stated publicly that he's still up in the air about whether he's going to accept the Medicaid expansion. We very much hope in northeastern Pennsylvania that he will, because I've talked to CEOs of hospital companies that have told me if the Medicaid expansion is not accepted here in Pennsylvania, they're going to have to close hospitals.
On issues like immigration, for instance, we've started to see Democrats and Republicans work together, but when it comes to health care, a vote like this, it seems to show this irreparable divide. What does this vote to repeal Obamacare, this most recent vote, what does it say about how splintered the House is right now?
I think it shows more than anything that the Republicans are splintered, because I think a lot of what's going on here there are some very hard right-wing hardliners who are insisting on repeating this repeal of Obamacare in the House. If it's 44 times, if it's 45 times, how many times do you have to express your opinion on whether you like Obamacare? So, to me, there are practical people in the Republican Party that I like to work with in the House that I know are against this, but there's another element that has to be appeased, and I think Speaker Boehner is doing just that. He's appeasing the right-wingers.
Congressman Matt Cartwright. Congressman, good to see you. Thank you so much for coming on.